Hi class. These are my students for today. How you doing?
I'm a Schaefer.
All right, here you are.
Go ahead.
Okay, so class, before we get started, we are going to talk about nitrous oxide and oxygen sedation. You guys are supposed to read the chapters associated with this and look at this PowerPoint before class started. Did everyone do that?
Yes.
Great. All right, we'll get started. Any questions to start with? All right, so our objectives for today: discovery of nitrous oxide, pain management and anxiety management, desirable characteristics of nitrous and oxygen, patient assessment, manufacturing and distribution of nitrous and oxygen gases, and equipment. Questions? And you guys are welcome to take notes if you want. Okay? So the schedule for today, we are going to go over this PowerPoint regarding nitrous oxygen sedation. We're going to review some pictures in the book regarding the nitrous, so like the parts that go with the nitrous, and we're going to just try and figure out how those all get connected. We're going to watch that. We're also going to watch an in-class video regarding nitrous, and for your guys' assessment, you're going to do a dental care practice test. I will give you the link for that when time comes. And if we have time, we are going to, you're going to practice finding each other's tidal volume on each other, just so you feel comfortable in clinic. So, to start, the discovery of nitrous, of both nitrous and oxygen, is credited to the English gentleman Sir Joseph Priestley. The actual discovery dates of these gases are somewhat in question because of Priestley's own uncertainty about what he had discovered. The periods cited in the literature vary from 1771 to 1777. During this time, he repeated several experiments that ultimately resulted in the gases we know today as N2O and O2. Any questions?
No.
Okay. Priestley experimented with nitrous air, a mixture of iron filings, sulfur, and water. The end product was a residual gas with considerably less volume than the original nitrous air. He called this dephlogisticated nitrous air, which is now known as nitrous oxide. During his experiments with nitrous air, Priestley became aware of another gas, which he termed good air. He found this air to be fit for respiration, and he titled this discovery dephlogisticated air, which is now known as oxygen. Huh. So you guys learned something new?
Yeah.
Right, so for pain and anxiety management options. So these are just very brief. If you guys have more questions, we can go over in more detail in the book. So let me know if we need to do that. Non-invasive, non-pharmacological approach to sedation. So words and actions are used by a clinician to facilitate a trusting relationship and positive rapport, right, with a patient. Hypnosis is another non-pharmacologic method of providing pain and anxiety relief. Acupuncture and acupressure are similar to hypnosis because they require further education and training before they are used. Systematic desensitization, relaxation therapy, biofeedback, and other coping strategies may be used to manage patient fear and anxiety. Distraction mechanisms are intended to divert the individual's attention away from a fear-provoking stimulus, and transcutaneous electrical nerve stimulation and electrical dental anesthesia are pain-relieving methods that use electricity to prevent impulses from reaching the brain. Questions, class? Moving on. So continue. Invasive pharmacologic approach to sedation. Local anesthesia is described as a loss of sensation in a localized area caused by an anesthetic agent that blocks the neurotransmission of impulse to the brain. The oral route may be used to administer pharmacologic agents for the purpose of relaxing an apprehensive individual without producing unconsciousness. Administering drugs orally is universally accepted by the general population. Patient cooperation is necessary but usually not problematic, except with children in some cases. The intramuscular route of administration is accomplished by direct injection into muscular tissue. The inhalation route of administration of medication offers many advantages and a few disadvantages. The clinical effect is rapid. Titration is possible, and elimination of the drug is usually rapid. This will be discussed as it pertains to nitrous in greater detail coming up. The IV route of administration is a direct deposition of drug into the circulatory system. Alright, so desirable characteristics of nitrous. An analgesic. Chapman and colleagues state that a mixture of 20% nitrous and 80% oxygen have the same analgesic equivalent, I don't know how to say that, as 15 milligrams of morphine. Other articles verifying the analgesic efficacy of nitrous have been reported. Do you guys know anything about analgesics so far in this program? Have we touched on it?
A little bit, yeah.
Okay. Any questions?
Not yet.
Okay. Can you guys help me out with that word?
Anxiolytics.
Alright. Patient anxiety has long been associated with healthcare. A person's mental ability to cope with certain situations can depend on such factors as age, gender, previous experiences, and personality characteristics. Relative amnestic. The amnestic property of nitrous sedation is another of its positive attributes. Postoperatively, patients often say they cannot recall the severity of their pain or anxiety or its duration. Rapid onset of action. Nitrous has a rapid onset of action because of the pharmacologic characteristics of nitrous. Clinical effects may begin in less than 30 seconds, with peak effects usually occurring in less than 5 minutes.
Wow.
Have you guys had nitrous done before?
Just
Yeah.
a few times.
How did you guys react?
Don't like it.
Yeah, I didn't love it.
Didn't love it. Okay.
No.
All right. We'll probably do that again in lab in a few weeks. We get to. Okay.
Awesome. Maybe we'll have a different experience now
Yes.
that we've learned more about it.
That's right. All right. Titration possible. Titration is the process of administering a drug incrementally to a specific level or endpoint of sedation. It allows for the exact amount of the drug necessary to be delivered to every patient at every appointment. Titration is very easily accomplished with nitrous sedation. Nitrous is one of several drugs that accommodate this concept of titration well. Rapid cognitive recovery. Inhalation of nitrous allows for cognitive recovery within 100% pure oxygen for a minimum of 5 minutes after termination of the drug. Depending on patient assessment, individual recovery time may vary. And there are minimal side effects with nitrous. Nitrous oxide is rapidly eliminated from the body after discontinuation of use. Therefore, at the conclusion of recovery, cognitive function is not affected. So, we need to do a patient assessment before we do any nitrous on someone. So, that includes patient history, an assessment of patients at risk, pre-procedural patient evaluation, informed consent, patient monitoring, and emergency preparedness. Do you guys have any questions on this? Okay, so if we do have questions on this, we can go back in the book at the end of this lecture, but as of now, we'll keep going. So, manufacturing and distribution of nitrous. I'm going to just kind of briefly go through this. The manufacturing process for nitrous is relatively simple. The raw ingredient, ammonium nitrate, is supplied as a clear liquid or as solid pellet-sized particles. This material is used for fertilizer and as a primary ingredient of explosives. Alright, so the manufactured product is kept refrigerated until it is directly transferred by insulated tanker trucks to hospitals with their own large storage facilities or to other gas repackagers and distributors. Approximately 90% of the nitrous produced by the major manufacturing companies is used in health settings. Did you guys know that?
No.
Okay. The field of dentistry uses up to 10% of the nitrous in clinics, so that's kind of a lot. The Food and Drug Administration regulates the nitrous industry. One of the most important facts to remember regarding compressed gases is that under no circumstances should grease, oil, or any other lubricating substance come in contact with the gas. Cylinders must be inspected on a regular basis according to the U.S. Department of Transportation, and a full nitrous cylinder contains approximately 95% liquid and 5% vapor. So now we are going to watch this short little video. Oops.
I think you have to exit.
Thank you, Megan.
Go back again.
Like to where you edit.
Alright, class, how are we doing?
Good.
Good. Alright.
This is the on and off button.
Okay.
This is the pressure reducing valve. This is the yoke. These are the pin index. This is the flow meter. This is the oxygen flash button.
Do you guys remember looking at this in our
This
book?
is the visible
Yeah.
back. This is called conducting tube. This section called anatomical dead space. This is the scavenging system. Both nitrous and oxygen gas come in and go through the nasal hood. Then the exhaled gas is suctioned by a small tube which is attached to a slow suction. The scavenging system connects to high-speed suction. Then airflow is adjusted by the knobs. All goes through the smaller tube.
Alright, so we will be doing this exact thing in lab. We'll have to learn how to connect these in order to properly treat our patients, okay? It's called the nasal hood. So these two tanks are located in the closet next to the clinic. Oxygen is green, nitrous is blue. That will be a test question.
Introduce the nitrous oxide sedation process.
So this bag needs to be not fully inflated, but it needs to be about halfway. We want it to be full. You just want to make sure that the patient is receiving that oxygen while getting nitrous.
For sign and symptoms.
Alright, class. Now, let's continue on here. So, if you guys could get your computers out and type in this URL, this is going to be a practice test for everyone. We are going to take it together, but I just want you to pull it up so we can all do it together, okay? So, this was supposed to be read before class, so let's hope we score well on this together, but we're all gonna help each other out. Here we go. Alright, okay, so class, I would like you to submit your scores after you take that to me. I'm also going to hand out this specific test, so this will give you good practice. This will be your quiz during the next class period, so this is a good study guide for you. So please study this after class today, and we will quiz over this next time. Does anyone have any questions?
questions is the quiz?
It is 20. Okay? 20. Any other questions? Okay. Thanks for coming in today. Have a great weekend.